When the patient arrives in the pre-procedural holding area, the nurse confirms the patient's identity by comparing the patient's statement of their name, date of birth, physician, procedure, and procedural site with information on the patient's hospital ID bracelet, in their medical record, and on the surgery schedule. The procedural or circulating nurse will follow the same process to verify the patient's identity. Verification must include confirmation of the patient's ID bracelet, informed consent, diagnostic tests, and history and physical. Prior to the surgical site marking, any team member needing to perform treatment or administer medication in the pre-procedural holding area must follow this verification process. When the physician performing the procedure arrives in the pre-procedural holding area, he or she will verify the patient identity and will mark the surgical site. If the patient refuses site marking, the surgical team will provide the patient with information concerning the importance of site marking and the implications of refusing site marking. After an informed decision, if the patient continues to refuse site marking, this will be documented in the patient's medical record according to unit standards. The surgery may then proceed at the discretion of the physician. When the patient consents to site marking, the physician performing the procedure will mark yes on the operative site using a permanent marker. Site marking should take place with the patient involved, awake, and aware, if at all possible. The mark will be placed so it remains visible after the patient has been prepped and draped. Site marking applies to all procedures involving a left-right distinction, multiple structures such as fingers or toes, and multiple levels such as spinal procedures. Some procedures do not require site marking, although verification of patient identity and a timeout are still required. These include situations where the individual performing the procedure is in continuous attendance with the patient from the time of the decision to perform the procedure through the informed consent and into the actual procedure. Single organ cases, gastroenterological cases, hemorrhoidectomies, catheter or instrument insertion where the site is not predetermined, dental surgeries where the operative tooth is indicated on the patient record and marked on the dental radiograph or dental diagram, premature infants for whom the site marking may cause a permanent tattoo. Before the patient is moved into the procedural area, the first two steps of the universal protocol, the preoperative verification process and the site marking, must be completed. Review of X-rays, MRIs, and C-arm fluoroscopy are used to verify the operative site, particularly in spinal surgery cases. When X-rays are utilized, the patient's name and identifying hospital number must be verified, and the X-rays must be viewed in an anatomically correct fashion. The site marking must remain visible after prep and draping are completed. Once the patient is in the procedural area, immediately prior to the start of the procedure, a timeout will occur. The surgical or procedural licensed clinical staff will initiate the timeout. The timeout will include verbal verification of the correct patient identity, correct site and side, and the correct procedure to be performed. The correct patient position, availability of any implants, and any necessary special equipment will be verified at this time. If a discrepancy occurs, the procedure will not begin until all questions and concerns by any and all team members are addressed and resolved. Each procedural area will complete the required documentation of compliance with the universal protocol. Verification of the correct patient, procedure, and procedural site will be performed any time the responsibility for care is transferred from one caregiver to another. In conclusion, remember to follow the 3 steps of the universal protocol: the preoperative verification process, marking the operative site, taking a timeout.